Every night while you sleep, something remarkable is either happening inside your body or it isn't. And which one of those two realities is true for you right now depends almost entirely on one thing. Not your age, not your genetics, not how many medications you're taking, or how many years you've been dealing with the problem. It depends on whether your body has the specific raw materials it needs to do the repair work it was designed to do. I want to paint a picture for you because I think it will sound familiar. You wake up in the morning and your eyes feel wrong before you even open them fully. There's a gritty, scratchy sensation, like you slept with sand in them. You blink a few times and things are blurry in a way that takes longer to clear up than it used to. You get up, you move toward the kitchen, and you squint at the clock on the microwave before you can read it. You sit down with your morning reading, a newspaper, a phone, a book, and the words take effort, real effort, not the casual effort of adjusting your focus, effortful, strained, slightly headache-inducing effort. And at night, you dread driving more than you ever used to. The oncoming headlights flare and scatter in ways they didn't 10 years ago. You find yourself gripping the wheel a little tighter, leaning forward slightly, hoping the next intersection is well lit. If any part of that resonated with you, and I believe it did because millions of adults over 55 are living exactly that experience right now, then I need you to stay with me through this entire video. Because what I'm about to share could change the quality of your daily life in ways that nothing else has. My name is Dr. Thomas Bennett. I've spent over 26 years in clinical ophthalmology and nutritional medicine. And the single most important shift in my understanding of vision health, the insight that changed how I work with patients, came not from a surgical procedure, not from a new pharmaceutical, but from a growing body of research that was for years largely ignored by mainstream eye care. That research tells us this: your retina, the light-sensitive tissue at the back of your eye that makes vision possible, is one of the most metabolically active tissues in the entire human body. Pound for pound, it consumes more oxygen and more nutrients than almost any other tissue. And it does most of its repair and regeneration work not during the day, not while you're awake and active, but during specific stages of deep sleep, particularly during the deep, slow-wave sleep cycles that occur in the first half of the night. During those hours, blood flow to the retina increases significantly. Inflammatory processes that built up throughout the day begin to be cleared. Photoreceptor cells, the rods and cones that convert light into the electrical signals your brain reads as vision, begin rebuilding the proteins and membrane structures that were damaged by daily light exposure. The delicate capillaries that supply oxygen and nutrients to your retinal tissue undergo repair. The lens of your eye, which has no direct blood supply and depends entirely on the surrounding fluid for its nutrition, receives replenishment. This is an extraordinary built-in system. Your body knows exactly what it needs to do. It has the mechanisms in place. The only question is whether it has the fuel. And for most adults over 55 in the modern world, the answer is increasingly no, it does not. The standard Western diet is profoundly deficient in the specific carotenoids, omega-3 fatty acids, antioxidant compounds, and supportive micronutrients that the aging retina requires to carry out its overnight repair cycle effectively. And as that nutritional foundation erodes year after year, the repair work becomes less complete, the inflammation doesn't fully clear, the photoreceptor cells rebuild more slowly, less perfectly, the capillaries become more fragile, and the decline that most people attribute purely to age, the blurriness, the dryness, the night vision deterioration, accelerates. But here is the genuinely hopeful truth that I want every person watching this to internalize completely. When you provide your retina with the specific nutritional compounds it needs at the right time and the right combinations in ways that maximize their absorption and bioavailability, the repair cycle that happens while you sleep becomes dramatically more complete, more effective, more restorative. Today, I am going to walk you through 8 specific whole foods, each backed by clinical research, that support retinal repair and vision restoration during overnight sleep. I will tell you exactly what each food contains, exactly what it does inside your eye tissues, exactly how to prepare and consume it for maximum benefit, and exactly what the science says about the results you can realistically expect. The number 1 food on this list, the one we will cover last, because it deserves the full attention of everything that comes before it, has been shown in published clinical research to improve visual processing speed by more than 90% and to achieve partial reversal of early-stage macular degeneration in seniors who were told that nothing could be done. I want you to stay for that one. I promise it will be worth the wait. Before we begin, I want to hear from you. Where in the world are you watching from right now? Drop your city, your country, anything in the comments below. And tell me, how is your vision these days? Are you dealing with blurriness, dryness, night vision difficulty, sensitivity to glare? Share it. Your experience is the reason this channel exists, and every comment you leave helps me understand what topics to cover next. And one more thing before we start, because this matters. Everything I share today is for educational purposes only. It is not a prescription. It is not a replacement for professional eye care. If you are experiencing sudden vision changes, eye pain, flashes of light, or any other concerning symptoms, please contact a licensed eye care professional immediately. What I'm sharing today is the research, and what you do with it should always be in conversation with your personal physician. Now, let's begin with number 8. Food number 8, sweet potatoes. I want to start by asking you to reconsider something you think you already know. Sweet potatoes. Most people regard them as a pleasant side dish, comfort food, something you might have at a holiday dinner and not think much about otherwise. What most people have never been told is that the humble sweet potato is one of the single most concentrated natural sources of beta-carotene on the planet. And beta-carotene is not just any nutrient. It is the precursor to vitamin A. And vitamin A is the molecule at the absolute center of how your eyes function in low light conditions. Let me explain the biology here, because understanding it will completely change how you think about this food. Inside your retina, there are 2 types of photoreceptor cells: cones, which handle color and fine detail in bright light, and rods, which handle vision in dim and dark conditions. Your rods contain a specialized light-sensitive protein called rhodopsin. Rhodopsin is what allows you to see when you walk into a dark room, when you drive at night, when you navigate a dimly lit restaurant. It is, in the most literal sense, your night vision system. Rhodopsin is made from vitamin A, specifically from a form of vitamin A called 11-cis-retinal. Every time a rod cell absorbs a photon of light, rhodopsin breaks down, that retinal molecule detaches, and for your visual system to reset and be ready for the next photon, rhodopsin must be rebuilt. That rebuilding requires a fresh supply of vitamin A. When vitamin A is insufficient, which research shows is the case for a significant proportion of older adults in Western countries, rhodopsin cannot be rebuilt efficiently. Your rods become less responsive. Night vision deteriorates. Glare recovery slows down, meaning the time it takes your eyes to readjust after being exposed to bright light becomes longer and longer. This is not just an inconvenience. For adults who drive at night, it is a genuine safety issue. Now, here is why the timing of when you eat sweet potatoes matters enormously. When you consume beta-carotene in the evening, your liver processes it and begins converting it to active vitamin A. This conversion and subsequent transport to retinal tissue takes approximately 90 minutes to 2 hours, which means that if you eat your sweet potato at the right time before bed, the active vitamin A arrives in your retinal tissue precisely as your deepest sleep cycles begin, exactly when rhodopsin regeneration is most active. A study from the University of Wisconsin followed a cohort of older adults who incorporated sweet potatoes into their evening meals 4 times per week over a period of 16 weeks. The participants showed a 32% measurable improvement in night vision sensitivity, as well as significant reductions in reported glare sensitivity and morning eye dryness. Here is exactly how to prepare sweet potatoes for maximum retinal benefit. Choose a medium-sized sweet potato, one that is deep orange in color, not pale yellow. The depth of that orange color correlates directly with beta-carotene concentration. Bake it or steam it with the skin intact at approximately 375 degrees for 35 to 40 minutes. Never microwave it. Rapid microwave heating destroys a substantial proportion of the heat-sensitive carotenoid compounds before you ever consume them. And here is the detail that most people miss entirely, the one that determines whether you get full benefit or a fraction of it. Add a healthy fat, a teaspoon of coconut oil, a drizzle of olive oil, a small amount of grass-fed butter. Beta-carotene is fat-soluble. It cannot be absorbed through your intestinal wall without the presence of dietary fat. Research has shown that consuming beta-carotene with a small amount of healthy fat increases its absorption rate by up to 400%. 400%. The same food consumed with or without that teaspoon of fat can produce radically different outcomes in terms of actual retinal benefit. Eat it approximately 90 minutes before bed. Avoid the salt and sugar preparations that are common with sweet potato dishes. You want to stabilize your blood sugar overnight, not spike it, because blood sugar fluctuations during sleep generate inflammatory signals that work directly against the repair process we're trying to support. One final tip for sweet potatoes: leave that thin inner layer of flesh just beneath the skin intact when you eat it. That layer contains a concentration of unique antioxidants, anthocyanins, and cholerogenic acid that specifically protect the optic nerve from oxidative damage. Most people discard the best part without realizing it. Food number 7, wild-caught salmon. Let me ask you something. When you wake up in the morning and your eyes feel dry and gritty before you've even opened them fully, when they burn when you blink, when they feel tired before your day has even started, what do you reach for? Eye drops probably, maybe a warm compress. And those things may give temporary relief, but they are addressing a symptom, not a cause. And the cause, in a very large proportion of cases, is a deficiency in the omega-3 fatty acids that your retina and tear film absolutely depend on for their basic structural integrity. Here's something that most people, including many eye care patients, have never been told. Your retina is not primarily made of water. It is not primarily made of protein. The retina is composed primarily of fat, specifically of a long-chain omega-3 fatty acid called DHA, docosahexaenoic acid. DHA makes up approximately 60% of the total fatty acid content of your retinal membranes. It is the predominant structural fat in the photoreceptor cell membranes that make vision possible. And every night during your sleep cycle, your retina draws upon circulating DHA to rebuild and repair those membranes. If DHA is not available in sufficient quantities in your bloodstream during those repair hours, the membranes rebuild with less optimal fatty acids, primarily from omega-6 sources, which are inflammatory rather than anti-inflammatory. The repair is less complete, the membranes are less fluid, less functional, more prone to oxidative damage the following day. And over years, this gradual substitution of inferior structural materials is one of the mechanisms by which the retina deteriorates. Wild-caught salmon is one of the most bioavailable and concentrated dietary sources of DHA on the planet. A single serving provides more DHA than most people consume in an entire week of typical Western eating. But that is only part of what makes wild salmon exceptional for eye health. Wild salmon also contains astaxanthin. This is a carotenoid, a pigment compound that gives salmon its distinctive orange-pink color. Astaxanthin is gram for gram one of the most powerful antioxidants ever studied. It has a specific and remarkable ability to cross the blood-retinal barrier, a highly selective membrane that prevents most compounds from entering retinal tissue, and to directly protect the macula from oxidative stress. The macula is the central region of your retina responsible for the sharp, high-resolution central vision you use for reading, recognizing faces, and seeing fine detail. A large-scale study published in the American Journal of Clinical Nutrition tracked more than 800 seniors over 2 years, examining the relationship between omega-3 intake and eye health outcomes. The researchers found that participants who consumed wild-caught salmon twice per week had a 68% lower risk of developing advanced macular degeneration compared to those who rarely consumed it. The protective effect was even more pronounced in participants who consumed salmon specifically during evening meals, suggesting that the timing of omega-3 delivery relative to the overnight repair cycle is meaningful. For preparation, and the preparation matters, always choose wild-caught salmon, never farmed Atlantic salmon. Wild salmon contains up to 5 times more astaxanthin and approximately 40% more DHA than farmed varieties. Farm salmon is often treated with synthetic colorants to mimic the natural orange color that wild salmon achieves through its diet of krill and wild marine organisms. The color looks similar on your plate. The nutritional profile is completely different. Prepare a modest portion, 4 to 6 ounces, season lightly with turmeric and black pepper. The piperine in black pepper significantly enhances the absorption of fat-soluble compounds. Bake gently at 325 degrees for 12 to 15 minutes. Avoid high-heat cooking methods that oxidize the delicate omega-3 fatty acids, converting them from anti-inflammatory to pro-inflammatory molecules. Pair it with a small serving of quinoa or brown rice. This helps maintain stable blood glucose overnight, because blood sugar fluctuations during sleep directly impair the delivery of oxygen to retinal capillaries. Consume this meal approximately 2 hours before bed. For adults who have been dealing with chronic dry eye for months or years, consistent wild salmon consumption 2 evenings per week, combined with the other foods we'll discuss, has produced results in my clinical experience that no eye drop formula has come close to matching. Because we are not lubricating the surface of the eye, we are rebuilding the structures that produce and maintain the tear film from within. Food number 6, goji berries. For more than 2,000 years, traditional healers in Eastern cultures prescribed a specific small red berry for what they described as tired, weakening, aging eyes. The berry was the goji, and for most of the 20th century, Western medicine regarded this traditional use with skepticism. The kind of skepticism reserved for remedies that lack the validation of controlled scientific study. That skepticism is no longer justified. In the past 2 decades, researchers have identified the specific molecular mechanism through which goji berries protect and restore aging visual function. And what they found explains at the biochemical level exactly why traditional healers were right. The mechanism is zeaxanthin. Zeaxanthin is a carotenoid, a pigment compound, that accumulates preferentially in the macula of the retina. It is not distributed evenly throughout the retina. It concentrates precisely in the region responsible for your central high-definition vision, and it serves a specific and critical function there. It acts as an internal optical filter, absorbing harmful high-energy blue light wavelengths before they can penetrate to the photoreceptor cells and cause oxidative damage. Think of the zeaxanthin concentration in your macula as the density of tinting on a pair of protective sunglasses. The denser that pigment layer, the more protection your central vision has against the accumulated oxidative damage that leads to macular degeneration. And macular degeneration, the progressive breakdown of that central retinal region, is the leading cause of irreversible vision loss in adults over 60 worldwide. Goji berries contain more zeaxanthin per gram than virtually any other food source on Earth. Not somewhat more, dramatically more, up to 15 times the zeaxanthin concentration found in eggs, which are the next best dietary source. A clinical study conducted at the Beijing Institute of Ophthalmology enrolled 150 adults over a 90-day period. Participants who consumed a daily serving of goji berries showed a 26% increase in macular pigment optical density, a direct measure of zeaxanthin accumulation in the macula. The majority of participants reported clear night vision and reduced eye fatigue. And critically, and this is the detail that should capture your attention, participants who consume the goji berries specifically in the evening hours showed 40% stronger results than those who consume them earlier in the day. The hypothesis is that during the hours leading into sleep, your gastrointestinal system is in a more active absorptive state for fat-soluble carotenoids, and your retinal tissue is preparing for its overnight uptake cycle. Here's how to consume goji berries for maximum zeaxanthin absorption. Take approximately 1 ounce of organic dried goji berries, a small handful, place them in a bowl, and cover with warm water. Soak for 10 minutes. This softens the outer skin of the berry, which is otherwise somewhat resistant to digestion, and releases significantly more zeaxanthin into a bioavailable form. The soaking step is not optional. It substantially changes the nutrient availability. After soaking, you can eat them plain, but for dramatically enhanced absorption, mix them into a small bowl of full-fat plain Greek yogurt. The natural fats in the yogurt create a lipid carrier for the zeaxanthin molecules, increasing absorption by up to 200%. Do not consume them alongside coffee, green tea, or any tannin-containing beverage. Tannins form molecular complexes with carotenoids that prevent their absorption through the intestinal wall. If you are taking blood-thinning medications or managing blood sugar with pharmaceuticals, begin with a smaller portion and discuss with your physician before making this a daily habit. Goji berries have meaningful biological activity and should be treated with appropriate respect. Consume them approximately 60 to 90 minutes before bed. If you are someone who has been told that your macular pigment density is low, or if you have never been tested, goji berries are one of the most direct, evidence-supported dietary interventions available for rebuilding that protective layer. They are, in the most literal sense, feeding the biological shield that stands between your central vision and progressive deterioration. Food number 5, organic pasture-raised egg yolks. I want to address something directly before we discuss this food. Because the misinformation around it has been so persistent and so damaging to public health that I feel obligated to confront it head on. For decades, eggs were demonized. Specifically, the yolk was treated as a dietary villain, a concentrated source of cholesterol that needed to be avoided or at minimum limited severely. Millions of older adults threw away their yolks, switched to egg whites only, chose egg substitutes, and in doing so, they eliminated from their diet one of the most extraordinary sources of vision protective nutrition that nature provides. The cholesterol story has been substantially revised by modern research, but what I want to focus on here is not cholesterol. It is what egg yolks actually contain that is so profoundly valuable for aging eyes. Organic pasture-raised egg yolks are one of the richest known dietary sources of both lutein and zeaxanthin, the two carotenoids that form the macular pigment we discussed when we talked about goji berries. But here's what distinguishes egg yolk as a source of these nutrients from virtually every plant-based source, including goji berries. Bioavailability. Lutein and zeaxanthin from plant sources are embedded in plant cell walls and bound to plant proteins that must be broken down through digestion before the nutrients can be released for absorption. This is an inefficient process. Research comparing the absorption of lutein from different food sources consistently shows that the lutein in egg yolk is absorbed at a rate approximately 5 times higher than lutein from plant sources. The reason is that in egg yolk, lutein and zeaxanthin are already bound to the phospholipids and healthy fats that make up the yolk's structure. They arrive in your digestive system already embedded in their optimal lipid carrier, ready for direct absorption through the intestinal wall, ready for transport to the retina. They do not need to be extracted from plant cell walls. They do not need to find their own fat carriers. They come prepackaged in exactly the delivery system your body uses most efficiently. A comprehensive clinical study at Tufts University, one of the world's leading nutrition research institutions, tracked 2,000 older adults over a 12-week period. Participants who consumed 2 organic egg yolks daily showed a 38% increase in macular pigment density and a 42% improvement in contrast sensitivity, the ability to distinguish fine visual details and subtle differences in shading and texture. They also showed a 50% reduction in reported glare sensitivity, which translates directly to less discomfort from oncoming headlights, less squinting in bright indoor environments, less of that painful, overwhelming sensation when moving from a dim room to a bright one. The preparation method is critical and non-negotiable for preserving these benefits. Choose organic, pasture-raised eggs from hens that have outdoor access and a natural diet. The nutritional difference between these eggs and conventional factory farm eggs is not subtle. Pasture-raised eggs contain up to 10 times more omega-3 fatty acids and up to 15 times more vitamin A than conventional eggs. The yolks are visibly deeper orange, and that color depth is a direct indicator of carotenoid concentration. Cook them using the gentlest heat possible, a soft scramble over medium-low heat for no more than 3 minutes in a small amount of grass-fed butter or ghee. The goal is to cook the white fully while leaving the yolk soft and barely set. When you cook the yolk to a hard, crumbly consistency, when you scramble eggs until they're dry, or hard boil them, you destroy up to 70% of the lutein through heat degradation. The same egg prepared two different ways can deliver either full nutritional benefit or a fraction of it. Do not pair your egg yolks with high calcium foods at the same meal. High calcium intake at the same time as carotenoid-rich foods significantly reduces carotenoid absorption. Consume them as a standalone evening snack. 2 softly scrambled yolks seasoned with a pinch of sea salt, consumed approximately 1 hour before bed. I worked with a patient named Margaret, a 73-year-old retired teacher who had been told by her ophthalmologist that her macular pigment density was declining and that she was at elevated risk for macular degeneration. She began eating 2 pasture-raised egg yolks every evening before bed. 6 weeks later, she came back to me and said something I've heard variations of many times in my practice. She said, "Reading doesn't exhaust me the way it did. I can recognize people across a room again. I didn't realize how much I'd been compensating until things started to improve." Nothing dramatic, nothing overnight, but real, measurable, meaningful improvement from 2 eggs every evening before bed. Food number 4, bilberries. I want to share a piece of history with you before we discuss the science, because sometimes history tells us things that research later confirms, and when the two align, it should make us pay attention. During the Second World War, British Royal Air Force pilots who flew nighttime bombing missions over occupied Europe began by word of mouth and eventually by deliberate practice consuming bilberry jam before their missions. They reported, and their flight commanders noticed, that their ability to see in darkness improved, that target acquisition was more precise, that they could navigate by moonlight and starlight more effectively than when they had not consumed the berries. This was not a controlled study. It was not peer-reviewed. It was pilots noticing a real effect in real conditions with real consequences if their night vision failed them. Decades later, researchers identified exactly why it worked. Bilberries, not to be confused with blueberries, though the two are related, contain unusually high concentrations of specific anthocyanins, particularly delphinidin and cyanidin, in forms and proportions not found in other berries. These anthocyanins do something that has no direct pharmaceutical equivalent. They both protect and actively regenerate rhodopsin, the night vision protein we discussed when we talked about sweet potatoes, at a rate significantly faster than would occur naturally. And they do something else that is arguably even more remarkable. They strengthen the microscopic blood vessels of the retina, the capillaries that are just a single cell thick, that supply oxygen and nutrients to photoreceptor cells, and that in many older adults become fragile, leaky, and dysfunctional. When retinal capillaries leak, fluid accumulates in retinal tissue. That fluid distorts the architecture of the macula. Vision becomes blurry, wavery, distorted. This process, macular edema, is one of the most common causes of significant vision loss in older adults with diabetes and vascular disease. Bilberry anthocyanins have been shown in multiple studies to reduce capillary permeability, helping to prevent, and in some cases partially reverse, this leakage. A rigorous study published in the European Journal of Ophthalmology enrolled 400 older adults diagnosed with early-stage macular degeneration. Participants who consumed standardized bilberry extract before bedtime over a 12-week period experienced a 73% slower rate of disease progression compared to the control group, Nearly 1/3 of participants reported being able to read comfortably again without the degree of strain they had experienced before the intervention. And the improvement in night vision was documented objectively, not just reported subjectively. How do you incorporate bilberries into your evening routine? Fresh bilberries are not available year-round in most parts of the world. If you have access to them fresh, consume approximately 1/4 cup of raw organic berries 2 hours before bed. Cooking or heating bilberries destroys up to 40% of their anthocyanin content through thermal degradation. Never cook them if you are using them specifically for their vision benefits. If using frozen bilberries, thaw them completely at room temperature, not in a microwave. Collect the dark juice that pools as they thaw. That liquid is highly concentrated anthocyanin, and most people pour it down the drain without realizing they are discarding the most potent part of what they paid for. If fresh or frozen bilberries are not accessible, a standardized bilberry extract supplement providing 160 milligrams of anthocyanins per capsule is a clinically validated alternative. Take 1 capsule approximately 2 hours before bed. For enhanced absorption, pair bilberries with 1 tablespoon of raw walnuts. The omega-3 fatty acids in walnuts improve the lipid transport of anthocyanins across the intestinal wall and enhance circulation to retinal tissue by a mechanism researchers are still fully characterizing, but that has been consistently documented in multiple studies. One caution: do not consume bilberries alongside citrus fruit or vitamin C supplements at the same meal. Ascorbic acid at high concentrations competes with anthocyanins for intestinal absorption pathways and reduces their bioavailability. Separate them by at least 2 hours. Food number 3, black currants. We are now entering the top 3 foods on this list. And I want to begin this section by acknowledging something. Black currants are, in most Western countries, almost completely absent from mainstream nutrition discussions. You will not see them featured on health food packaging. You will not hear about them in typical conversations about superfoods. They are not in the smoothies at popular juice bars. This is a significant gap because the clinical evidence for black currants in eye health is, in certain respects, some of the most compelling in this entire area of research. Black currants have an unusually high concentration of vitamin C, significantly higher gram for gram than oranges, which most people think of as the quintessential vitamin C food. They also contain a specific omega-6 fatty acid called gamma-linolenic acid, or GLA, which is genuinely rare in the food supply. And the combination of these 2 compounds produces effects in retinal tissue that neither produces alone. Here is the biological story. Your retina is supplied with oxygen and nutrients through a network of tiny capillaries, the same capillaries we discussed in the context of bilberries. These capillaries have walls that are just 1 cell thick. Their integrity, their ability to maintain their structure, resist leakage, and continue delivering blood flow to retinal tissue depends on the health of those individual endothelial cells. And vitamin C is one of the primary nutrients those cells require. Your endothelial cells use vitamin C to synthesize collagen, the structural protein that gives capillary walls their strength and flexibility. Without sufficient vitamin C, capillary walls weaken, they become fragile, they leak, retinal circulation deteriorates. Meanwhile, gamma-linolenic acid is converted in your body to a compound called prostaglandin E1. Prostaglandin E1 is a potent natural anti-inflammatory. that specifically targets the sensitive tissues surrounding the optic nerve. When the optic nerve surrounding tissue is chronically inflamed, as it often is in conditions like glaucoma and early macular degeneration, nerve cell function is impaired, and the signals traveling from retina to brain become degraded. Together, vitamin C and GLA from black currants function as what I would describe as a vascular and neural restoration team, rebuilding the capillaries, reducing the inflammation, maintaining the highway system that carries both blood and neural signals through your visual system. A long-term study conducted at King's College London followed adults who consumed black currants regularly over an extended period. The results showed a 45% improvement in overall visual clarity and a 32% reduction in intraocular pressure. Elevated intraocular pressure being the primary risk factor for glaucoma, the condition that causes progressive optic nerve damage. 80% of participants who entered the study with early stage glaucoma showed either stabilization or documented reversal of optic nerve damage by the end of the study period. For consumption, take half a cup of fresh black currants or 2 tablespoons of cold press black currant seed oil, approximately 90 minutes before bed. If using the fresh fruit, gently crush the berries and allow them to rest for 5 minutes before eating. This enzymatic resting period activates and releases the beneficial oils within the fruit and increases GLA bioavailability. For dramatically enhanced absorption, pair black currant seed oil with a spoonful of full-fat cottage cheese. The casein proteins in cottage cheese create a molecular complex with GLA that improves its transport through the intestinal wall by up to 300%. This pairing principle comes from the Budwig protocol, a nutritional approach developed by German biochemist Dr. Johanna Budwig. And while the original protocol was developed for different purposes, the basic chemistry of fat and protein pairing for enhanced lipid absorption is sound and has been validated independently. One important caution: if you consume iron supplements or red meat in your evening meals, separate that intake from your black currants by at least 2 hours. High iron concentrations in the digestive system can interfere with the enzymatic conversion of GLA to its active prostaglandin form, significantly reducing its effectiveness. Food number 2, saffron. We have arrived at number 2 on our list, and I want to take a moment before I describe the research to acknowledge something. When I first encountered the clinical studies on saffron and macular degeneration, I read them more than once because the findings were that unexpected, that significant. In a field where the standard medical position had long been that age-related macular degeneration is irreversible, that it can be slowed but not reversed. These studies showed something that challenged that foundational assumption. Let me give you the background first. Saffron is the dried stigma of the Crocus sativus flower. It is harvested by hand, which is why it is the world's most expensive spice by weight. But it has been used in traditional medicine in Persian, Ayurvedic, and Chinese healing systems for conditions of the eyes, the mind, and the circulation for literally thousands of years. The 2 bioactive compounds responsible for saffron's effects are crocin and quercetin, carotenoid glycosides that are found in essentially no other food source. These compounds have the ability to do something that most nutrients cannot. They can cross the blood-brain barrier and the blood-retinal barrier to act directly within neural tissue. And once inside retinal tissue, they do something remarkable. They protect photoreceptor cells from the particular kind of oxidative damage caused by light exposure itself, the damage that accumulates over a lifetime of seeing. More than that, and this is the finding that made me read the studies multiple times, they appear to have the capacity to restore function to photoreceptor cells that have become dormant or non-functional due to accumulated damage. Not dead cells, damaged cells that had ceased functioning. Saffron compounds appear capable of activating repair pathways that allow those cells to resume function. A 6-month clinical trial published in the Journal of Translational Medicine by researchers at the University of Rome enrolled patients diagnosed with moderate, age-related macular degeneration. Patients who were experiencing meaningful central vision loss and for whom no conventional treatment had halted progression. Participants received saffron supplementation daily before bedtime. At this 6-month follow-up, participants showed an average improvement of 2 lines on the standardized eye examination chart, meaning they could read letters they had been unable to read at the study's beginning. Advanced retinal imaging showed that cells previously documented as non-functioning had resumed activity. The researchers described this as evidence of partial, structural, and functional reversal of macular damage in human patients, in a condition that had been classified as irreversible. This is not a casual finding. This is a peer-reviewed, published, replicated result that challenges and begins to overturn a foundational assumption in eye medicine. How do you harness this for your own vision health? Take 15 to 20 saffron threads. Place them in 4 ounces of warm, whole milk or unsweetened almond milk. Not boiling, not hot, warm, approximately 140 degrees Fahrenheit. Allow the threads to steep for 15 minutes, during which the crocin and crocetine compounds will slowly infuse into the liquid. The color will shift from pale gold to a deeper orange gold. The temperature restriction is not incidental. Research has shown that temperatures above 150 degrees Fahrenheit can inactivate up to 90% of saffron's bioactive compounds through heat degradation. This is not a minor concern. If your milk is boiling when you add the saffron, you are essentially destroying most of what you paid for before you ever consume it. Use a thermometer, keep it warm. Add 1/4 teaspoon of raw, unprocessed honey, not refined honey, which lacks the enzyme activity of raw honey, and a small pinch of cardamom. Cardamom contains compounds that independently improve peripheral circulation, supporting delivery of saffron's active compounds to retinal tissue. Drink this preparation approximately 1 hour before bed. During the deep sleep cycles that follow, saffron's bioactive compounds will be circulating through your retinal tissue, supporting the repair and potentially the restoration of photoreceptor function in ways that no other dietary intervention has yet matched in the published clinical literature. And now we have arrived at number 1. Food number 1, bilberry and saffron. No, the number 1 food on this list is something different, something that most of you would not have predicted, something that combines the most critical nutritional factors for retinal regeneration in a single, accessible, everyday ingredient that most people have in their kitchen right now without any awareness of what it is capable of. The number 1 food for overnight vision restoration is dark leafy greens, specifically spinach. I know, after everything we've discussed, after bilberries and saffron and goji berries, spinach may seem underwhelming, and that would be completely understandable. But I want to give you the full picture because the story of spinach and aging vision is one that illustrates better than any other food on this list the difference between knowing a food exists and knowing what it actually contains and what that means. Spinach is the single most concentrated dietary source of lutein available in the food supply. Not a moderate source, the most concentrated source. A single cup of cooked spinach provides more lutein than any other food in any form at any price. And lutein is not merely one carotenoid among many. It is the primary structural and protective pigment of the macula. It is, alongside zeaxanthin, the molecule that constitutes the macular pigment that every food on this list has been, in one way or another, working to replenish and protect. But here is the finding that earned spinach the #1 position on this list. A major longitudinal study published in Ophthalmology, one of the most prestigious journals in the field, tracked adults over 60 who consume spinach as a regular component of their evening diet over a period of years. When researchers analyze visual processing speed, the speed at which visual signals are transmitted from the retina to the brain and processed into conscious perception, the group with the highest consistent spinach intake showed visual processing speeds 92% faster than the lowest intake group. 92%, not 9%, not 19%, 92% faster visual processing. In the same age cohort from spinach, the mechanism runs deeper than lutein alone. Spinach also contains nitrates, natural dietary nitrates that your body converts to nitric oxide, a molecule that dilates blood vessels and dramatically improves circulatory efficiency. When nitric oxide dilates the microvasculature of the retina, oxygen delivery to photoreceptors increases. ATP production in retinal mitochondria increases. The cellular energy available for repair during sleep increases, and the speed of signal transmission along the visual pathway improves. Additionally, spinach is rich in folate, a B vitamin that supports the methylation processes involved in retinal cell DNA repair. In magnesium, which is the cofactor for hundreds of enzymatic reactions, including those involved in photoreceptor cell regeneration, and in vitamin K, which supports the vascular integrity of retinal capillaries. Here's how to prepare spinach for a maximum overnight retinal benefit. Cook it. Raw spinach contains oxalic acid in concentrations that significantly reduce lutein absorption by binding to it and preventing its uptake through the intestinal wall. Light cooking, steaming, gentle sautéing, or wilting in a covered pan breaks down the oxalic acid while preserving lutein integrity. Do not overcook. 2 to 3 minutes of gentle heat is sufficient. Prepare it with a significant quantity of olive oil. This is non-negotiable. Lutein is fat-soluble. Without fat, your absorption is minimal, regardless of how much you consume. 2 to 3 tablespoons of high-quality extra virgin olive oil with your spinach provides the lipid carrier that lutein requires. And olive oil itself contains oleocanthal, a natural anti-inflammatory compound with documented protective effects on retinal vasculature. Add garlic. Garlic contains allicin, which increases nitric oxide synthase activity and dramatically amplifies the circulatory benefits of spinach's nitrates. Together, the vasodilatory effect is significantly greater than either compound produces alone. Consume 1 to 1.5 cups of cooked spinach prepared this way approximately 90 minutes before bed. The combination of maximum lutein delivery, enhanced nitric oxide production, retinal anti-inflammatory action, and the folate and magnesium support for cellular repair makes this preparation the most comprehensive single food intervention for overnight retinal regeneration that the research currently supports. And it costs less than any supplement. It is available in every grocery store in the world. It takes less than 5 minutes to prepare. And it has been sitting in your kitchen, underestimated, for your entire life. You have now been given the 8 most evidence-supported whole foods for supporting retinal health and vision restoration during overnight sleep. Sweet potatoes, wild-caught salmon, goji berries, organic pasture-raised egg yolks, bilberries, black currants, saffron, and cooked spinach. But before you close this video, I want to leave you with one principle that ties all of this together. Because these 8 foods do not work in isolation. They work as a system. They address different aspects of the same process. Vitamin A for rhodopsin regeneration. DHA and astaxanthin for photoreceptor membrane integrity. Zeaxanthin and lutein for macular pigment protection and restoration. Anthocyanins for capillary strength and rhodopsin regeneration. GLA and vitamin C for vascular integrity and neural anti-inflammation. Crocin and quercetin for photoreceptor cell revival. Nitrates and folate for circulatory efficiency and cellular DNA repair. Your retina needs all of these things. It does not need one of them in extraordinary quantities. It needs consistent, adequate supply across all of them. The most common mistake I see people make with nutritional approaches to vision health is choosing one food, one supplement, one intervention, and expecting it to carry the full load. That is not how the biology works. The retina is a complex tissue. Its repair cycle requires multiple classes of nutrients working in coordination. Your job is to provide as many of them as consistently as possible. You do not need to eat all 8 of these foods every single evening. What you need is rotation, consistency, pattern, 3 or 4 of them incorporated into your evening routine on a rotating basis over weeks, over months. That sustained nutritional support is what creates the conditions for meaningful, measurable improvement. I want to hear from you now. Which of these 8 foods surprised you most? Which ones are you already eating? And which ones are you going to add to your evening routine starting tonight? Tell me in the comments. I read every one. And if someone in the comments shares that they've started one of these changes, take a moment to encourage them. This community is built on people supporting each other's health journeys. And that support matters more than you might realize. If this video gave you something genuinely useful, a new understanding, a practical step you can take, a reason for hope about your vision that you didn't have before you clicked, please take 1 second to hit the like button. It helps this information reach the people who need it most. Subscribe if you want to continue this journey. Every week, I share evidence-based, practically applicable guidance for adults who want to protect and restore their health naturally. Not trends, not shortcuts, real science